My name is Daniel G, and I have my phone here as a timer. And I'll be doing the conscious unconscious athlete evaluation, also known as the 5-minute quiz. First, we're going to start out by doing history. First, we do try to get a history from those around us. For instance, mechanism of the incident, injury, previous medical history, current medication, and allergies. Next, we do observations. On our way to the athletes, we put on gloves, look at environmental factors. Next, we check for their body position to see if their hands are raised above their head for spinal cord injury, and we look for obvious signs of severe bleeding, deformations, and to see if their skin is a different color or not. Next, we're looking at the athlete. We're checking for their consciousness, unconsciousness, and if they're like knocked out, we call 911 immediately. Next, we're checking for the primary assessment. First, obviously, do not remove helmet. We check for signs of life to see if they're still breathing, and we listen to their breath and their heartbeat for around 10 seconds. And obviously, we have to get the AED, and we have to do compressions. I think 30 compressions per tube breath and 100 compressions per minute. And for life-threatening bleeding, we check for severe bleeding, and we have to stop bleeding by putting our fingers on the pressure points in the brachial and femoral arteries here and on your leg, and in your here and in your groin area. For a second, we do special injury precaution. Arms up obviously indicates as you said, spinal cord injury. For stabilizing the head and the neck, and if they're conscious, we put a cervical collar on them, and then we log roll them to like whether they're laying on their back. Laying on their stomach. We have to log roll them even if it might hurt them even more. And then we look for symptoms of shock, skin color, weak pulse. They breathe really fast. Their pupils are dilated. Their blood pressure may drop. And if they're blue, it's a hemorrhage. And if they're red, it's a heat stroke. Next, we take their vitals for level of consciousness. Take their pulse. We take their blood pressure, respiration rate and depth, skin temperature, and then at last pupils to see if they we do the Pearl test to see if they're really active. To we hold a flashlight up to their pupils. Next, we are moved on to secondary assessment. We ask some history, of course. Where does it hurt? Do you have pain in your neck? What happened? Did you hear or feel anything? Do you feel any numbness anywhere else? Can you move your hands? Wiggle your fingers. Can you move your feet? Wiggle your toes. And next we move on to orientation. We ask who, when, and what they were doing. And then we do the head to toe survey. We check for obviously deformities, severe injuries, bleeding, fractures, deformities, edema, and head. We check for scalp, eyes, and ear, nose, and mouth, and blood. Then we check cervical spine, and we have to take off the cervical collar, point tenderness, dislocations,